Welcome back to this new module on diabetes and heart failure. So, the pathogenesis of heart failure in diabetes is multifactorial, of which in the presence of diabetes. So, this is in the presence of diabetes. Independently, the CAD and hypertension can contribute significantly, but in the presence of diabetes, the cardiotoxic tetrad consists of CAD, hypertension, diabetic cardiomyopathy, and extracellular fluid volume expansion. So these are the four factors in the presence of diabetes. This is so four factors which contribute to heart failure. As traditionally how we had learnt is there can be a systemic hypertension or it can be a valvular dysfunction, where like the concentric hypertrophy of the left ventricle, it gets diastolic dysfunction, then develops a left atrial hypertension, then left atrium gets affected, then there is a remodeling, pulmonary hypertension develops, then the right ventricle gets involved, and finally like a right atrium. So right atrial hypertension followed by right atrium goes for a remodeling, and there is a systolic dysfunction. So this is how we have learned all through the years, like how hypertension can contribute to heart failure. But the emerging model says that the current model says that there are various pro-inflammatory coexisting conditions. It could be obesity, it could be cancer, or it could be diabetes, where there is a systemic microvascular endothelial inflammation. So there is a systemic microvascular endothelial inflammation whereby there is an increase in the oxidative stress, muscle inflammation, microvascular dysfunction, which contribute to myofiber stiffness, fibrosis, and global cardiac remodeling and dysfunction. So this is how it sets in. So the pro-inflammatory coexisting condition could be anything like we said, obesity, diabetes, or cancer. Anything can cause these factors, and that is how heart failure sets in. So this is the current understanding of our heart failure, how it develops. As far the diabetes is concerned, there are various factors. There can be epigenetics, like the people might be more prone for heart failure because of the epigenetic, which defines like who will get and why some people get, is all defined by epigenetic. Also, there is an RAS activation. The renin, angiotensin, aldosterone system gets activated. The mitochondrial dysfunction happens. There is an oxidative stress which contribute to the oxidative stress leads to lots of advanced glycation end products are getting released. There is inflammation. The inflammation produces lots of pro-inflammatory cytokines, and also there is an altered insulin signaling because of the calcium mishandling at the cellular level. Also, there is an increased fatty acid utilization. We will come to it in a minute's time. So, there is a increased fatty acid utilization. Apart from that, there is an endoplasmic reticular stress also which happens. So, there are various factors of all this. There are various factors which contribute to increased incidence of heart failure among diabetic patients.